Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, which is the first program of the new year, we will talk to Dr. Arun Garg from Canada India Network Society, and our focus will be as to how in 2022 we need to adopt those practices which can help us physically as well as mentally. And my focus today will be on integrative thinking and integrative medicine. And there's a lot being talked about precise medicine also. So let's go over to Dr. Arun Garg and continue with the discussion. Dr. Garg, good evening. How are you, sir?
Very well. Thank you. Thank
Happy
you
New
for
Year.
connecting.
Happy New Year to you.
Same to you. What a year it has been. Looking forward for a year which will be COVID-free, hopefully.
Let's pray for that. Absolutely. So, Dr. Garg, it's that time of the year when people have set up resolutions for the new year, and people are, a lot of encouragement is there that they need to fulfill those resolutions, and they are started working on those. And amongst those resolutions, mostly one relates to our diet and our health, and mostly people want to stay fit, slim, and have a good health. So, today in this program, we would like to focus on these aspects of eating, diet, and also what we ought to know from your experience as to where we are lacking and what we need to do.
Yeah, I think I'm very happy to be part of the program. Very happy to be sharing with our viewers and listeners about the role of lifestyle in health. And I think, Harpreet, it will be remiss if I don't reaffirm that COVID has changed things, though things were changing even before, but now it is imperative. It's really must that we bring the changes and make COVID, though it has been catastrophic, better for our health. And lifestyle becomes very critical in it. And I think all our work is now related to how to lower the burden of chronic diseases like diabetes, hypertension, coronary artery disease through lifestyle interventions. There is a lot of science behind it. And as you rightly pointed out, our work is really focusing on how to expand our healthcare so it's best of the East and best of the West. And what we mean by that is that the Western medicine is very good in reductive science. So physical elements and physical interventions, external interventions, but it is very poor on internal interventions. What you do as yourself for lifestyle, how do you empower yourself, how do you educate yourself, how do you engage in your own health is as important as anything external interventions. And COVID clearly showed that. And I think we need to really recapture that landscape. And I think it will be very, very great outcome if people, especially in our community, go for lifestyle interventions related to behavior. And the most important part of the behavior is diet. And I think that's what we want to focus on. There is
Absolutely.
so much science behind diet now that diet plays 80%, if not more, even in the role of health promotion and illness prevention. At least in the health promotion and illness prevention, diet is very important. Other factors like sleep and stress and exercise or movement, people will say are also important. But in my perspective, diet is the easiest one to get hold of. Is easiest one. It's totally in our control. What we put in, what we eat, how we eat, when we eat. It's totally in our control. And with the empowerment of precision medicine, with the empowerment of internal intervention, I think it's very doable. So I think today our message is very clear. We have a problem, Houston, let's work on it. COVID has clearly shown that pandemics can be with us, and it really just totally disturbed the equilibrium. It really changes the economy. And so, to avoid chronic disease pandemics, which we don't put it in that way, but diabetes is one of the biggest pandemic prevailing. As high as 20%, 30% of the people could be potentially pre-diabetic. And
Right.
this is where we want to carry the message to our community. This is where we want to connect with our community that it's up to you. And diet plays a very important role. And I think we could go more prescriptive in terms of what are the specific things people can do
Absolutely.
to overcome this lifestyle, and what are the diet interventions they can do.
Well, Dr. Garg, thanks for laying the foundation of our talk. You have elaborately said what is the problem and where we need to start focusing on. And of course, it depends upon the people. People want, and especially this time of the year, as I said in the beginning, is a time when people are motivated, encouraged to carry on with their resolutions. And actually, every year we set up resolutions, but as time passes by, life comes to normal. We again go back to that same slumber what we are in, and then we forget about the resolutions. But today I think it will be an opportunity for us to reach out to those people when you talk about life interventions and precision medicine. Could you please elaborate a little bit on this? Because for the common person, when we talk about precision medicine, what does that denote?
Yeah. So what I'm talking about is, and it should ring very well with our community. Our community comes from the heritage where great emphasis is put on mind, or on buddhi, or intellect. That has been part of our heritage. And what I'm saying is that in modernizing it, not only we should depend on external interventions, like taking a pill, or or surgery or something when the disease sets in. Let's use the power of internal intervention, which is based on mind, to overcome and empower ourselves, so we eat right. And eating right is very simple. It's not, what I'm saying is not very, very difficult. And I'm not prescribing extremes. That's just not the case. First thing is balance. You have to have balance in terms of what you eat. So balance between carbohydrates, proteins, and fat. The diet which we have evolved for our community is one of the best diet I can think of. Right from the beginning, we have said we should eat fruits, vegetables, fiber, and that's what our diet is. Most of the diet we have, plant-based, is very rich in fiber. Where we have gone kind of little deranged, and we need to fine tune it, is in carbohydrates. Carbohydrates are simple things like potatoes, rice, and grain. Unfortunately, in our diet, we mix these three in a greater proportion than we should. So I think the first very specific recommendation or consideration is that reduce the amount of carbohydrates and balance it between protein, fat, and carbohydrates.
Great. Dr.
Normally, our
Garg,
diet, if you look at,
when you say that we have sidetracked, our diet has been extremely great as compared to other diets. But what has gone wrong now is focus more on carbohydrates. But lifestyle changes, when you talk about, even though we are in a pandemic, but still now we find that people are still wanting to have things from outside rather than cooking at home. How does that have an impact as to the food that we are consuming from outside, which is fully processed and is having a lot of carbohydrates? We'll go for a short break and we'll be shortly back, and we'll continue with the discussion and learn more from you as to how to again come back on the path of recovery and good health. We'll talk all about this after the short break.
ਮਿਹਨਤ, ਮੁਸ਼ੱਕਤ, ਸੰਘਰਸ਼ ਅਤੇ ਸੱਚਾਈ ਤੇ ਰਾਹ ਤੇ ਚੱਲਣ ਵਾਲੀ ਕੌਮਾਂ ਦੀ ਕਾਮਯਾਬੀ ਹਮੇਸ਼ਾ ਹੀ ਕਦਮ ਚੁੰਮਦੀ ਹੈ। ਇਸ ਦੀ ਜੀਂਦੀ ਜਾਗਦੀ ਮਿਸਾਲ ਹੈ ਹਾਲ 'ਚ ਹੀ ਹੋਈ ਫਤਿਹ ਮੈਦਾਨ ਪੰਜਾਬੀ ਕਿਸਾਨੀ ਮੋਰਚੇ ਦੀ। ਆਪਣੇ ਕਾਨੂੰਨੀ ਹੱਕਾਂ ਦੀ ਰਾਖੀ ਤੁਹਾਨੂੰ ਆਪ ਰੱਖਣੀ ਪੈਣੀ ਹੈ। ਨਵੇਂ ਸਾਲ ਦੀਆਂ ਤੁਹਾਨੂੰ ਤੇ ਤੁਹਾਡੇ ਪਰਿਵਾਰ ਨੂੰ ਲੱਖ ਲੱਖ ਵਧਾਈਆਂ ਹੋਣ। ਕਾਨੂੰਨ ਦੇ ਦਾਇਰੇ 'ਚ ਰਹਿ ਕੇ ਤੁਹਾਡੀ ਜ਼ਿੰਦਗੀ ਇੰਨੀ ਖੁਸ਼ਨੁਮਾ ਹੋਵੇ ਤਾਂ ਕਿ ਨਾ ਹੀ ਤੁਹਾਨੂੰ ਕਿਸੇ ਵਕੀਲ, ਦਲੀਲ ਜਾਂ ਅਪੀਲ ਦੀ ਲੋੜ ਹੀ ਪਵੇ। ਤੁਹਾਡਾ ਆਪਣਾ ਵਕੀਲ ਬ੍ਰਿਜਮੋਹਨ, bridgemohan.com। ਧੰਨਵਾਦ।
ਹਰ ਰੰਗ ਹੈ ਸਾਡੇ ਕੋਲ, ਹਰ ਮਾਡਲ, ਹਰ ਇੱਕ ਦੀ ਆਪਣੀ ਵੱਖਰੀ ਪਹਿਚਾਣ। ਅਸੀਂ ਇੱਕ ਪਰਿਵਾਰ ਹਾਂ, ਸਾਡਾ ਕਰਮ ਹੈ ਅੱਗੇ ਵਧਾਉਣਾ, ਸਫ਼ਰ ਨੂੰ ਸੌਖਾ ਬਣਾਉਣਾ। ਬਸੰਤ ਮੋਟਰਸ, ਤੁਹਾਡੇ ਨਾਲ, ਤੁਹਾਡੇ ਕਰਕੇ।
ਕੀ ਤੁਸੀਂ ਸਰੀ, ਡੈਲਟਾ, ਰਿਚਮੰਡ, ਐਬਸਫੋਰਡ ਜਾਂ ਵੈਂਕੂਵਰ ਵਿੱਚ ਨਵਾਂ ਘਰ ਬਣਾਉਣ ਬਾਰੇ ਸੋਚ ਰਹੇ ਹੋ ਜਾਂ ਫਿਰ ਪੁਰਾਣੇ ਘਰ ਨੂੰ ਰੈਨੋਵੇਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ? ਤੁਹਾਨੂੰ ਲੋੜ ਹੈ ਇੱਕ ਤਜਰਬੇਕਾਰ ਬਿਲਡਰ, ਇੱਕ ਕ੍ਰੀਏਟਿਵ ਇੰਟੀਰੀਅਰ ਡਿਜ਼ਾਈਨਰ ਦੀ, ਜੋ ਤੁਹਾਨੂੰ ਸਹੀ ਤਰ੍ਹਾਂ ਗਾਈਡ ਕਰ ਸਕਣ ਤੇ ਤੁਹਾਡੇ ਸੁਪਨੇ ਦੇ ਘਰ ਨੂੰ ਉਸਾਰ ਸਕਣ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ ਹਰਪ੍ਰੀਤ ਜਾਂ ਸੰਦੀਪ 6048259295 ਉੱਤੇ।
ਪਾਪਾ, ਤੁਸੀਂ ਅੱਜ ਕਿਉਂ ਉਦਾਸ ਹੋ?
बेटा, तेरे चाचा दी कोरोना वायरस करके डेथ हो गई है क्योंकि उसने मेरे कहने के बावजूद भी टीका नहीं लगवाया।
ਚਾਚਾ ਜੀ ਤਾਂ ਪੜ੍ਹੇ ਲਿਖੇ, ਸਿਹਤਮੰਦ ਅਤੇ ਰੋਜ਼ ਐਕਸਰਸਾਈਜ਼ ਕਰਨ ਵਾਲੇ ਸਨ, ਫਿਰ ਉਹਨਾਂ ਨੇ ਟੀਕਾ ਕਿਉਂ ਨਹੀਂ ਲਗਵਾਇਆ?
ਉਸ ਨੂੰ ਡਰ ਸੀ ਕਿ ਇਸ ਟੀਕੇ ਦੇ ਮਾੜੇ ਪ੍ਰਭਾਵ ਹੋ ਸਕਦੇ ਹਨ ਅਤੇ ਇਹ ਸੁਰੱਖਿਅਤ ਨਹੀਂ ਹੈ। ਹਾਲਾਂਕਿ ਮੈਂ ਉਹਨੂੰ ਬਹੁਤ ਸਮਝਾਇਆ ਕਿ ਇਹ ਸਭ ਅਫਵਾਹਾਂ ਹਨ ਅਤੇ ਇਹ ਟੀਕੇ ਵਿਗਿਆਨਿਕਾਂ ਅਤੇ ਡਾਕਟਰਾਂ ਦੀ ਮਿਹਨਤ ਅਤੇ ਖੋਜ ਦਾ ਨਤੀਜਾ ਹਨ।
ਪਾਪਾ, ਹੁਣ ਤਾਂ ਸਾਡੇ ਸਾਰੇ ਪਰਿਵਾਰ ਦੇ ਮੈਂਬਰਾਂ ਨੂੰ ਟੀਕਾ ਜ਼ਰੂਰ ਲਗਵਾ ਲੈਣਾ ਚਾਹੀਦਾ ਹੈ। ਸਿੱਖ ਹੈਲਥ ਫਾਊਂਡੇਸ਼ਨ ਦੀ ਅਪੀਲ ਹੈ ਕਿ ਅੱਜ ਹੀ ਵੈਕਸੀਨੇਸ਼ਨ ਕਰਵਾਓ ਅਤੇ ਆਪਣੇ ਨਾਲਦਿਆਂ ਨੂੰ ਵੀ ਟੀਕਾ ਲਗਵਾਉਣ ਦੀ ਪ੍ਰੇਰਣਾ ਕਰੋ। ਆਓ ਅਸੀਂ ਸਿੱਖ ਹੈਲਥ ਫਾਊਂਡੇਸ਼ਨ ਦੀ ਇਸ ਮੁਹਿੰਮ ਦਾ ਹਿੱਸਾ ਬਣੀਏ।
Once again, welcome back to the program. This program is being brought to you with the support of Day-to-Day Wholesale Cash and Carry. This is British Columbia's largest South Asian grocery store where you can buy groceries, party-wear, kitchenware at wholesale prices. More than 5,000 products are displayed on the shelves. For best prices, unique grocery buying experience and high-quality products, come to 7843 128th Street, Surrey, 604-503-8787. Our next sponsor is Agnihotri Immigration Consulting. If you're wanting to know about temporary status, about PRship, new to Canada, you're an international student, you want to know about citizenship, you want to hire foreign workers, you want to know about express entry or sponsor parents or grandparents, Neera Agnihotri can help you, who has been working as a certified immigration consultant since 2006. For more information, call 604-597-2284. 604-597-2284. Our guest today is Dr. Arun Garg, and our focus is on how to have good health and focusing on integrative thinking and precise medicine, what he's talking about. So let's get back to him and continue with the discussion. So Dr. Garg, as you were talking about the change in our eating habits, our diet is very good, but because we have started consuming more carbohydrates, and as I was talking to you before the break, that despite being in a pandemic, people are still not wanting to cook at home, and it's mostly now they want to eat from outside. Now, could you tell a little bit as to how we, as you were talking about reducing the carbohydrates and increasing the protein and other intake, so what needs to be focused on?
Yeah, I think as far as our food goes, that's a behavior change which is most difficult. So I think we need to stay with whatever the diet we prefer. Each one is individual, and I think we need to empower them to eat what they like. We like spicy food, that's fine. Whatever food you like, you should stay with it. It will be a mistake to say change your diet totally. You have to be aware of what you're eating and how you're eating it. Most important thing is when you eat. So I think those are some of the changes they can make. Rather than eating quite late at night, they should have their meal earlier so that it can digest itself and you could have a reasonable amount that carbohydrates can be absorbed, etc. So I think those things are not very difficult to follow and makes a huge difference in what happens to you. And day in, day out, when you eat late, when you eat more than you need, and you eat without knowing what you're eating, that causes problem and it can be avoided. Specifically, I would say in our diet, carbohydrates are a major component of our diet. So we have roti, chapati, chawal, aloo, all three in the same meal. Watch that out, and maybe just have two of those, or even one. Ideal would be just to have one of that combination along with vegetables, fruits, and meat if you are a meat eater, or plant-based proteins. Dal is one of the best protein. Lentils are one of the best proteins. मसूर की दाल या जो अपना साग and roti, makka ki roti, those are some very good foods. In the right proportion, they go a long ways. The one thing and the only thing I would say is prescribed as far as I see, which we must avoid, is added sugar and added salt. Those two things we added. And what I mean by that is the sugar, the simple refined white sugar you add to your food is a very big culprit of inflammation. The science has shown that that increase in glucose, especially when we eat large amount of it, and like average tea, people make a small cup of tea. I've noticed people will add 1 to 2 tablespoon or
Right.
teaspoon. Teaspoon is 5 grams. Tablespoon is 15 grams of sugar.
Right.
So in one load, you are getting 10 grams of sugar.
And if we are
That's a
having tea 4 or
lot.
5 times, we can well imagine how much
Yeah,
sugar we are consuming.
two teaspoons is 10 grams of sugar. And then I notice our people eat a lot of jalebis, rasgullas, and gulab jamuns, which are very syrupy. And those are the things people can watch. And I think if those are the things they reduce, they go long ways in overcoming the problem.
So sugar is the
And,
culprit. The major
sugar.
culprit you consider is the sugar.
Sorry?
Dr. Garg? The major culprit you feel is the sugar.
Yeah, that's the major culprit, and sugar, even the white sugar,
Right.
the sugar taken out of cane sugar, beet sugar, all this is modern inventions of last 100 years, 200 years. Before that, white sugar didn't exist, and that sugar has essentially nothing but because it's refined to the hilt,
Right.
and it has nothing but glucose and fructose, and that is a huge problem because both of those get into the body, and glucose and fructose to a certain extent get converted into fat, and that's where your pancreas, your liver, your fat cells, your heart, your muscles, they all get deranged.
Right.
So I think obviously a show like this doesn't permit to explain biochemical basis of inflammation. This is where insulin resistance starts.
Right.
And I think we were talking about precision medicine. Individualization of food is so important because each one of us are different, and what we eat and how we eat totally depend on our personalities.
Right.
And our personalities are made up of what in our heritage we talk about doshas, which are into the 5 elements. So there
Right.
is a very good evidence of the ancient wisdom that individuality is very important. Modern science is now taking us to epigenetics and genetics, which are also individualization of what we do. And epigenetics, people just starting to understand it, is not your that genes have mutation or anything, but how genes are controlled are affected by epigenetics, and
Right.
that is affected by your behavior, and that's intergenerational. So I think all in all, to sum it up, behavior and diet is the key part of being healthy. It's based on the modern science of biochemical medicine.
Right.
It's based on the modern science of epigenetics and precision medicine. And it's also tied to our ancient wisdom of elements and koshas and precision medicine. So I think if we're going to make one change, that is the change we should strive for. And to put the practicality of it, what I'm saying in the diet modifications, no added sugar.
Right.
No added sugar to your coffee and tea. Reduce the amount of syrupy sweets at any time. And then balance between carbohydrates, fat, and proteins. And in our diet, we eat too much, even complex carbohydrates like grains, potatoes, and rice. All three are very loaded in complex carbohydrates. So just to have the balance. Some of our viewers, if they're interested, normally the Canada Food Guide, the most recent Canada Food Guide, is very, very good in terms of how they divide the plate. And they say 4 portions of it. And vegetables, fresh vegetables, fruits are very important.
Right.
So I think, Sir PG, if people just follow these simple things post-COVID, we could reduce the amount of chronic diseases.
Absolutely. Dr. Garg, let's go for a break. We'll be back, and from here onwards in the last segment, we'll focus on how much to eat. And as you always point out, that we should be very careful of what we are consuming, when we are consuming, how we are consuming. These are basic, simple things, but still probably we have forgotten those, and we need to come back to our roots. So we'll talk all about this in the last segment.
ਮਿਹਨਤ ਮੁਸ਼ੱਕਤ ਸੰਘਰਸ਼ ਅਤੇ ਸੱਚਾਈ ਤੇ ਰਾਹ ਤੇ ਚੱਲਣ ਵਾਲੀ ਕੌਮਾਂ ਦੀ ਕਾਮਯਾਬੀ ਹਮੇਸ਼ਾ ਹੀ ਕਦਮ ਚੁੰਮਦੀ ਹੈ। ਇਸ ਦੀ ਜੀਂਦੀ ਜਾਗਦੀ ਮਿਸਾਲ ਹੈ ਹਾਲ 'ਚ ਹੀ ਹੋਈ ਫਤਿਹ ਮੈਦਾਨ ਪੰਜਾਬੀ ਕਿਸਾਨੀ ਮੋਰਚੇ ਦੀ। ਆਪਣੇ ਕਾਨੂੰਨੀ ਹੱਕਾਂ ਦੀ ਰਾਖੀ ਤੁਹਾਨੂੰ ਆਪ ਰੱਖਣੀ ਪੈਣੀ ਹੈ। ਨਵੇਂ ਸਾਲ ਦੀਆਂ ਤੁਹਾਨੂੰ ਤੇ ਤੁਹਾਡੇ ਪਰਿਵਾਰ ਨੂੰ ਲੱਖ ਲੱਖ ਵਧਾਈਆਂ ਹੋਣ। ਕਾਨੂੰਨ ਦੇ ਦਾਇਰੇ 'ਚ ਰਹਿ ਕੇ ਤੁਹਾਡੀ ਜ਼ਿੰਦਗੀ ਇੰਨੀ ਖੁਸ਼ਨੁਮਾ ਹੋਵੇ ਤਾਂ ਕਿ ਨਾ ਹੀ ਤੁਹਾਨੂੰ ਕਿਸੇ ਵਕੀਲ, ਦਲੀਲ ਜਾਂ ਅਪੀਲ ਦੀ ਲੋੜ ਹੀ ਪਵੇ। ਤੁਹਾਡਾ ਆਪਣਾ ਵਕੀਲ bridgemohan.com। ਧੰਨਵਾਦ।
है जुल्म ढाने का अंदाज भी कितना हंसी हमारी जान पर बनाई है जब जब उसने अंगड़ाई ली। कभी खामोश रहते हैं, कभी शोर होता है। मोहब्बत में शरारत का मजा कुछ और होता है। दिल को जज्बात का तोहफा, खामोशियों को बात का तोहफा, खूबसूरती में जड़ी नजाकत अदाओं की चांद से मुखड़े को चांद सा तोहफा।
भारत ज्वेलर्स, सच्चे प्यार की चमक जैसा। फाइल बिजनेस सेंटर सरी।
ਕੁਦਰਤ ਦੇ ਸੌਮਿਆਂ ਦੀ ਵਰਤੋਂ ਆਯੁਰਵੇਦਾ ਰਾਹੀਂ 5000 ਸਾਲਾਂ ਤੋਂ ਚੱਲਦੀ ਆ ਰਹੀ ਹੈ ਤੇ ਹੁਣ ਕੈਨੇਡਾ ਵਿੱਚ ਹੀ ਬਣਾਏ ਗਏ ਹੈਲਥ ਕੈਨੇਡਾ ਵੱਲੋਂ ਅਪਰੂਵਡ 100% ਸ਼ੁੱਧ ਆਯੁਰਵੈਦਿਕ ਡਾਇਟਰੀ ਸਪਲੀਮੈਂਟਸ ਦਾ ਲਾਭ ਲੈ ਸਕਦੇ ਹੋ। ਸਟ੍ਰੈਸ, ਐਂਗਜ਼ਾਇਟੀ, ਇਨਸੋਮਨੀਆ, ਬਲੱਡ ਸ਼ੂਗਰ, ਕਿਡਨੀ, ਬਲੈਡਰ, ਹਾਜ਼ਮਾ, ਆਈਸਾਈਟ ਜਾਂ ਕਿਸੇ ਵੀ ਕਿਸਮ ਦੀ ਬਿਮਾਰੀ ਦਾ ਆਰਗੈਨਿਕ ਇਲਾਜ, ਜੋੜਾਂ ਦੀਆਂ ਦਰਦਾਂ ਤੇ ਸਰੀਰਕ ਮਸਾਜ ਲਈ ਕਈ ਕਿਸਮ ਦੇ ਆਯੁਰਵੈਦਿਕ ਤੇਲ ਵੀ ਉਪਲਬਧ ਹਨ। ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਲਈ ਕਾਲ 604 628 2003।
ਚਾਹੁੰਦੇ ਹੋ ਨਵੇਂ ਤੇ ਵਧੀਆ ਅਪਲਾਈਐਂਸਸ ਜਿਵੇਂ ਕਿ ਸਟੋਵ, ਓਵਨ, ਫ੍ਰਿਜ, ਵਾਸ਼ਰ ਡਰਾਇਰ, ਮਾਈਕ੍ਰੋਵੇਵ, ਫ੍ਰੀਜ਼ਰਸ ਜਾਂ ਡਿਸ਼ਵਾਸ਼ਰ, ਤਾਂ ਫਿਰ ਪਹੁੰਚੋ ਪ੍ਰੀਮੀਅਮ ਅਪਲਾਈਐਂਸਸ ਤੇ। ਇਹਨਾਂ ਦੀਆਂ 3 ਬ੍ਰਾਂਚਸ ਸਰੀ, ਐਬਟਸਫੋਰਡ ਤੇ ਚਿਲਵੈਕ ਵਿੱਚ ਹਨ। ਇੱਥੇ ਤੁਹਾਨੂੰ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਅਪਲਾਈਐਂਸਸ ਮਿਲਣਗੇ। ਇਹ ਡਿਲੀਵਰੀ ਤੇ ਇੰਸਟਾਲੇਸ਼ਨ ਵੀ ਕਰਦੇ ਹਨ। ਸਪੈਸ਼ਲ ਪੈਕੇजेस ਫॉर ਬਿਲਡਰਸ ਐਂਡ ਹੋਮ ਓਨਰਸ। ਕਾਲ 6045904140 604 590 4140। This program is being brought to you with the support of AMC Insurance. They have 9 branches in the Lower Mainland to serve you, and they're open 7 days a week from 8:30 a.m. onwards till 9 p.m. If you're wanting to buy home, auto, travel, business, life or recreational insurance, they can guide you. For more information, call 604-507-6666. Our next sponsor is Best Home Kitchen Cabinets. ਘਰ ਦੀ ਸ਼ਾਨ ਹੁੰਦੀ ਕਿਚਨ ਤੇ ਇਸ ਨੂੰ ਸੋਹਣਾ ਬਣਾਉਣ ਵਿੱਚ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਲੋਅਰ ਮੇਨਲੈਂਡ ਵਿੱਚ ਇੱਕ ਜਾਣੀ ਪਛਾਣੀ ਕੰਪਨੀ ਹਨ। ਕਸਟਮ ਹਾਈ ਐਂਡ ਘਰਾਂ ਤੋਂ ਲੈ ਕੇ ਮਲਟੀ ਯੂਨਿਟ ਪ੍ਰੋਜੈਕਟਸ ਇਹ ਕਰਦੇ ਨੇ। ਹਰ ਤਰ੍ਹਾਂ ਦਾ ਸਪੈਸ਼ਲ ਕੈਬਨਿਟ ਦਾ ਕੰਮ ਕਰਾਉਣ ਲਈ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਨੂੰ ਯਾਦ ਰੱਖੋ। ਕਾਲ ਕਰੋ ਸੁਰਜੀਤ ਤੇਸੀ 604-591-8171. Our guest today is Dr. Arun Garg, and we are talking about integrative medicine and integrative thinking along with focus on precise medicine.